the topic for today. Now, as you have alluded to, first on our panelists will be Ms. Flora Mashala. I think I'll take this opportunity to remind our panelists to please put their videos on when they speak. And Ms. Mashala will speak to she'll speak to adverse events following immunizations, and she'll also speak to issues around local and international statistics, and also ways of reporting adverse events following immunizations. Ms. Flora, over to you. Thank you.
Thank you very much, Sibusiso, and good morning to everyone who's watching. I'm just waiting for my video to come. Okay. All right, I'm just going to share a few slides. Okay. Sibusiso, please confirm if you can see my slides.
Yes, we can see your slides. The only thing I'll ask is if it's possible, can you put them on presentation mode?
Yes, I will, sure.
Thank you, Flora.
Okay, so thank you very much, everyone, and good morning to everyone who's watching, who had an opportunity to come and to listen to us as we share the information regarding the self-reporting of suspected adverse drug reactions and adverse events following immunization. So my name is Flora, as I've already been introduced. So on this presentation, I'll particularly be paying more attention into the reporting tool, which is the MedSafety app that SAHPRA has actually acquired and launched in April 2021 to improve and increase reporting of adverse events following immunization and adverse drug reactions following the use of medicines. And this was actually launched as a result of the rollout of the vaccines, just to ensure that everyone in South Africa will have the opportunity to report at the comfort of their homes. So as it has already been indicated that I'm the pharmacovigilance manager, I thought I should take a bit of time just to give a bit of background with regards to pharmacovigilance. What is pharmacovigilance? So pharmaco, basically, it means the drug, and the vigilare, it means to keep watch. So it means we are watching the performance of the medicines on the market. So as Portia has highlighted, the definition thereof, the scientific definition, basically, it means that there's the science and the activities that are relating to detection. Detection basically means how do we get this information? How do we detect these adverse events or adverse drug reactions? And the assessment is when we go through this and then we look into it and see, is it really related or not related to the use of the medicines? And the understanding thereof, what are the mechanisms that are involved with regards to the appearance of what we're seeing, and how do we prevent these adverse effects or any other drug-related problems? So this definition is provided by the WHO. So what is it that we actually are trying to look for when we say we watch this medicine's performance? So we look for the adverse drug events or the adverse drug reactions. And I thought it's of importance just to provide a bit of background with regards to what is the difference between the two, so that it can be clear to everyone to understand what is the difference. So an adverse drug event, basically, it's any untoward medical occurrence in a patient administered medicines that may present during treatment with that medicines. But what's important is to note that it does not necessarily have a relationship, a causal relationship with this treatment. So an adverse event, it's very broad. It's a descriptive term, and it includes anything that can happen when a patient is taking a particular treatment. Then what is a reaction compared to what we call an adverse event? So a reaction, it's noxious and it's unintended response to a medicines. So it can include lack of efficacy, it can occur at normal doses, and it can also result from overdose, misuse, or abuse of a medicines. It may be a known side effect of a medicines or a vaccine. It may be new, or it may be something that was not previously recognized. So the difference between the two is that an adverse drug reaction, contrary to an event, it's characterized by the occurrence of a suspected causal relationship between the drug and the reaction. Hence, I highlighted the two parts in green to say an event excuse me, does not necessarily have a causal relationship with the treatment. However, with the adverse drug reaction, there's a suspected causal relationship between the two. And I've actually provided a picture here, which actually indicates that an adverse drug reaction is a broad term and it includes adverse drug reactions. So what we receive in the system is actually adverse drug events. However, when we do the assessment, we are trying to identify those that are actually adverse drug reactions to say, yes, definitely there's a suspected causal relationship between the drug and the reaction. So I'm hoping that at least there's a distinction and people will be able to understand what is the difference between an adverse event and adverse drug reaction. So what are we aiming when we perform this pharmacovigilance? We're aiming to detect if there's any increase in the frequency of the known adverse drug reactions or adverse drug events. So for instance, in the package insert, you'll find that they will indicate that a headache, it appears on a common level, but then as we continue with pharmacovigilance, we monitor the occurrence of this headache adverse drug reaction or adverse event, and then you find that with time, that the common part of it, then it changes to very common or rare or something of that nature. So that's when we actually look at the frequency of this known adverse drug reactions. Then secondly, what we're trying to do is early detection of unknown adverse drug reactions or adverse events, and if there's any drug interactions. So that is very important actually, because when we do clinical trials, then certain adverse drug reactions or adverse events, they are not actually identified. Those that are rare or those that take long time to occur. Then with pharmacovigilance, that's an opportunity for us then to look more closer into the medicine's performance to see if there's anything that we missed during clinical trials that we need now to bring it to the attention of the public. That's one of the reasons why we do pharmacovigilance. Then thirdly, we need to identify the risk factors who are at risk of a certain adverse event or a certain adverse drug reactions, and what are the possible mechanisms that are underlying the occurrence of those adverse drug reactions or events. And then furthermore, we do estimation of quantitative aspects of the benefit risk analysis. That's where we determine whether a drug is supposed to be in the market or not, following its approval based on what we're seeing in terms of the reports that we're receiving. Then we do what we call benefit risk analysis of that product. And then lastly, we disseminate information to the public, to healthcare professionals to improve the drug prescribing of their particular medicines. Then the objectives there of pharmacovigilance, we want to improve the safety in relation to the medicines that are being used, and then as well as the paramedical and all medical care and interventions. And then what's of importance is to improve public health and safety in relation to the use of the medicines. So that is the most fundamental thing about pharmacovigilance, so that the public can understand what is it that is being, what takes place with regards to the medicines that they're taking. And then we contribute to the assessment of the benefit, the harm, effectiveness, and risk of those medicines. And lastly, which is very important, is to promote understanding, clinical training, and effective communication to healthcare professionals and the public. Then how do we do this pharmacovigilance? What are the activities that are involved? So we're going to start at the top where we do collection. And collection basically is all about reporting of adverse drug reactions or adverse events. Then once we have collected this information, we collate it into a system, and we have a system in place that was developed by WHO that we call the VigiFlow system. However, because of the MedSafety app, then there's a system that we call the Vigilance Hub, which is the backside of the MedSafety app. So we have the two systems and they are interconnected. So the information ultimately lands into one system and we do the analysis. And then after doing the analysis, then we do the assessments. On the assessments, that's when I indicated that we're trying to determine the relationship between the adverse event and the medicines itself. And then we do what we call a signal. A signal, basically, it's information. It's the safety information that was previously not understood, or the new information, and then you need more investigation into this to understand the relationship between the medicines and the reaction that have been identified. Then we do risk communications, and then after risk communications, then prevention of adverse drug reactions, and then it continues. So it's a continuous cycle that takes place, and these are the activities for pharmacovigilance. Then in terms of collection of adverse drug reactions, we've got tools that are in place for reporting adverse drug reactions and adverse events. So we've got the MedSafety app, which is basically the main topic about this presentation. And then we have the e-reporting. The e-reporting is basically available on the SAHPRA website. And we also have the paper-based system. So the e-reporting is an add-on onto the system that I spoke to, the Vigiflow system. You can report anything on the e-reporting if you go on the SAHPRA website and then you look for reporting an adverse drug reaction or an adverse event. If you click on it, then it will take you to this screen here that says SAHPRA adverse drug reaction and product quality reporting, and then automatically you need to accept the conditions thereof, and then you're ready to go. Then the paper-based system, basically we've got two systems. One is the adverse drug reaction and quality product reporting, and the second one is the adverse events following immunization. And Prof will be touching on that. So with this system, basically you go to a nearest healthcare center. It may be a clinic, it may be a pharmacy, it can be a doctor's offices, where you report, and they will complete this on your behalf if they will not be using a MedSafety app. Then the last one, which is the main thing about this presentation, is the MedSafety app, and this presentation will actually concentrate more on the MedSafety app. So what is this MedSafety app that we're talking to? So it's a mobile application, and this mobile application, basically, it was developed by the Medicines and Health Products Regulatory Authority agents, which is the Medicine Regulatory Authority that is based in the UK, together with WHO and what we call the UMC. Portia has spoken to the UMC for reporting of adverse drug reactions and adverse events following immunization. It was developed through what we call the Recognized Adverse Drug Reaction Project, whereby they were looking for digital tools to support pharmacovigilance activity. So it's an international mobile for use, for drug safety use, and it's used by different regions. And it's a two-way information sharing, whereby the regulatory authorities, they share their news and medicines watch list tool, while the public as well can report on the very same tool. And the app, it's actually available for both healthcare professionals and the public. And it's available on the latest app, Apple Store rather, and Google Play Store for reporting. So why did we saw the need to actually have the MedSafety app? I actually touched on it as I did the introduction. So we wanted to simplify and promote reporting of suspected adverse drug reactions. So according to the international statistics, it is indicated that less than 2% of the adverse drug reactions or adverse events are being reported for medicines. So in South Africa, we don't necessarily have specific statistics that talks to that. However, reporting, it has been at its lowest. So we thought through the use of the MedSafety app, together with the rollout of the COVID-19 vaccines, it's an opportunity for us to actually promote pharmacovigilance and reporting of adverse drug reactions and adverse events following immunization. So we launched the MedSafety app. So MedSafety app is one of our strategies as highlighted to actually address adverse drug reactions or adverse events under reporting. And then thirdly, we want to promote pharmacovigilance locally. It has come to our attention that not so many people actually are aware of the medicines that they use and the effects thereof. So this is an opportunity to actually promote pharmacovigilance. And then fourthly, we want to strengthen spontaneous reporting. And we needed to replace the paper-based forms as they are cumbersome. And then what is of importance as well is that it strengthens data quality because you can actually indicate what mandatory fields should be there so that the kind of data that you receive can actually inform clinical decision making. Then what are the features of this app and the benefits? So it's simple, number one, which I think is of importance, and convenient way of reporting. You can store and save uncompleted or unsubmitted reports in the event whereby maybe you don't have access to internet, or maybe the signal is giving you a problem. You can always save the report and send it later. And then it generates an email to the user that acknowledges the reports that we received the report. And there will be a reference number which you can always use for follow-up purposes. It's a readily available platform for feedback about submitted reports. It creates a watch list to follow products of interest. And then lastly, it is currently available in English, but we're working on providing it in different other local languages. Then how to report using the MedSafety app. So what one does is that they need to download the MedSafety app on their smartphones, choose their region, whether it's from South Africa, then acknowledge the privacy statement. So I'll say a bit with regards to the privacy statement, and then you create a profile, whether you're a healthcare professional or you're a member of the public. Then you are ready to report either your adverse drug reaction or adverse event following immunization. So what's important to note is that on the MedSafety app, there are actually two forms that are available. There's one for the public, it will say MOP, and then there's one for healthcare professionals. It doesn't necessarily, it's not specified. Then you choose the one that is relevant. And the difference between the forms is that the healthcare professional form is more in the medical language rather than the one for the member of the public, which is easy to understand and it will facilitate reporting. Then, once the form is submitted, then the report will be available on the backside of the MedSafety app, which is the Vigilance Hub, where both the districts, the provincial and the national office, including SAHPRA, will be able to view the report. If there's a need maybe for follow-up information that we receive, then we amend, and then we capture and inspect the data. So I thought I should just provide a few pics that relates to the MedSafety app. The first pic on the left-hand side, it will be the landing page where you need to provide your email address and your password, and you create an account. And then the second one is the one that talks to the privacy statement. So on the privacy statement, if you click on the privacy statement, I understand the privacy statement. If you click on it, it will take you to the next pic where it says South African Health Products Regulatory Authority, MedSafety app privacy statement. So the privacy statement, basically, it relates information with regards to what is your role as a reporter, and as the regulator, what are we going to do with your information? So it highlights the need for us to have that information and then use it for the public safety issues only, nothing more than that. So it's very important that the public are aware of this and they read through this, so that when you say understand the privacy statement and you click on the second one, then you know that what your information will be used for. And the last one on the far right, it's basically the menu that talks to the news, that talks to the products, the watch list, whether you want to report or not. Then I thought it's of importance that I indicate the use of the MedSafety app. As I've highlighted, reporting has been at its lowest in South Africa, but through the use of MedSafety app, it has improved a bit. If you look on my far left, you will see that April, we had about 701 active users and 671 new users. And May, it increased. And then June, it went a little bit down. And then July, it increased. And August, it's increasing. So we are working, there's progress with regards to the uptake of the MedSafety app. However, if you look at this and you compare this to about 15 million vaccine recipients, you'd realize that this shows that there's still lack of reporting, there's still low underreporting. So we would prefer that we download the Med Safety app as South Africans, and we use it not only for adverse events following immunization, but also for reporting of any adverse drug, suspected adverse drug that one may have experienced after taking their medicines. Then this is just a link to the Med Safety app. I would not be going through this because I will be showing it on the microsite, which is a communication platform that we have developed. And then lastly, I would like to show a short video, and I'm hoping that it's going to work, that talks to the Med Safety app.
Well, South Africans encouraged there to download the Med Safety app to report on in the event that you experience adverse reactions after taking medicines. The South African Health Products Regulatory Authority, in partnership with the National Department of Health and other associated entities, webinar on self-reporting on suspected adverse reactions of medicines and vaccines. Remember that this comes after the Department of Health's nationwide COVID-19 vaccine rollout plan more than 3 months ago. Now, this webinar provides an opportunity for SAHPRA and the Department of Health to engage with citizens on not only the adverse effects of the vaccines, but of medical products in general. This is the agenda on SABC News. Let's now take a quick break. And before we take a break, let's take a look